Hello everyone, my name is Brenna Baker and I am a public health major at UNC Greensboro. Today I will be discussing many aspects of Parkinson's disease for the Disease Investigation Project for HEA 314 Public Health Diseases. Feel free to pause the slides to review the information if I'm going too fast. Parkinson's disease is a neurodegenerative disorder where brain cells progressively die. The cause is still unknown, but scientists believe it's a combination of genetic and environmental factors. The main finding in brains with people with PD is a loss of dopaminergic neurons in the area of the brain known as the substantia nigra. In the past 20 years, 6 different genes have been found to identify causing familial Parkinson's disease. They support the notion that common pathogenic mechanisms exist. Parkinson's disease has many various risk factors and surprisingly quite a few different protective factors. The main risk factors for PD include exposure to pesticides, dairy products, history of melanoma, traumatic brain injuries, the use of methamphetamines, which damages the dopamine producing neurons, and other inconclusive minor risks like season of birth, birth weight, parental age, infections of the CNS, influenza virus, hepatitis C, and autoimmune diseases. Protective factors include tobacco, caffeine, green and black tea consumption, urate, physical activity, NSAIDs, calcium channel blockers, and statins. So there is no one way to diagnose Parkinson's disease. However, there are various symptoms and diagnostic tests that are used in combination. Making an accurate diagnosis of Parkinson's, particularly in its early stages, is difficult, but a skilled physician can come to a fairly sound conclusion that it is Parkinson's disease. It is important to remember that 2 of the 4 main symptoms must be present over a period of time for the neurologist to consider it Parkinson's disease. These include shaking or tremors, bradykinesia, which is slowness of movement, stiffness or rigidity of the arms, legs, or trunk, and postural instability, which is problems with balance and possible falls. In the United States each year, about 50 to 60,000 people are diagnosed with Parkinson's disease. From 2000 to 2013, the rates increased for black and white males and black and white females. As many as 1 million Americans live with Parkinson's disease. An estimate to 7 to 10 million people worldwide are living with Parkinson's disease. The incidence increases with age, but an estimated 4% of people are diagnosed before the age of 50, and men are 1.5 times more likely to have Parkinson's than women. Unfortunately, there is no cure for Parkinson's disease. Medications are used sometimes in combination to lessen or slow the progression of the disease symptoms. Treatment strategies depend on a few different factors: the patient's age, disease stage, their most troublesome symptoms, and the balance between effectiveness and risk for each treatment option. Medical marijuana has been proven to help with motor complications, neuroprotection, depression, and anxiety. People with PD who start exercising earlier and a minimum of 2.5 hours a week experience a slow decline in quality of life compared to those who started later. Finally, surgery is reserved for PD patients who have exhausted medical treatment of PD tremor who suffer from profound motor fluctuation. This chart shows the effectiveness levels of recommendation for therapeutic interventions when treating early Parkinson's disease. There are many foundations and projects nationwide that support Parkinson's disease and research, which include Parkinson's Foundation, Parkinson's Outcome Project, and the Michael J. Fox Foundation for Parkinson's Research. A more local organization for Parkinson's disease support is the Parkinson's Association of the Carolinas, which has a mission to serve as a resource for individuals and their families affected by Parkinson's disease in the Carolinas through education, community outreach, and direct support. The Healthy People 2020 objective for Parkinson's disease is to reduce the prevalence and severity of the disorder. This is important because the diagnosis of these disorders may lead to earlier and more effective treatment of related diseases and conditions.